How's everybody doing? My name is Anthony Brian Logan, and today we got to talk about Public Health England not detecting one case of the flu in the entirety of the United Kingdom, or at least in England, because you know England is one part of UK, but that's a different story. I digress. They've not detected one case of the flu, at least in England, for 2021. So January, February, the first 7 to 8 weeks, not one flu case has been detected. Now, I don't just mean hospitalizations. I'm talking about a flu case at all. There was like 700,000 samples sent for, I guess, the virus test. But in all of those tests, not one case of the flu was detected. Now, before I even get into the details of what they said, the reason for this could be, general question, do you believe that? Do you truly believe that there's no flu anymore in UK? Or at least in England in 2021. I mean, come on. Like, you're talking about a thing that's been around since, forever. And it always happens every single year. People always get it. They always die from it. This is a thing that happens all over the entire world. So why all of a sudden now is there no cases of it in UK, or at least in England in 2021? What's going on? Now, they're attributing this to the shutdowns, the lockdowns, and social distancing, and mask wearing, hand washing, hand sanitizing. Okay, so if the flu is pretty much killed off as a result of this, then why hasn't it killed off the virus? Why are they still saying we need to have the vaccine and we got to do more shutdowns and lockdowns and everything else? Now, I understand these are two different viruses, right? You got the flu and you got the C virus. They're different. But how much different are they? Are they so different to where the flu is eradicated just by your simple everyday measures, and then the virus is not? And some are going to say, oh, there's a vaccine for the flu. Is it a vaccine if you can take it every year? I mean, it's a flu shot. I never really heard it referred to as the vaccine. Like I said, if it's a vaccine, you wouldn't take it every year. You would take it one time. Like when you're a kid and you get your vaccines for X, Y, and Z thing. You're not going to get that every single year. So what is it really? I don't really know, but I digress. The whole point is that that's not really the focus. Is anyone even getting the flu shot anymore? Or is it all about the big virus, the C virus coming from the Orient? That's pretty much the focus nowadays. And I would think that if you did all this stuff, all these lockdowns and shutdowns and mask wearing, social distancing, hand washing, that would at least mitigate the virus, but apparently it's not. Oh, you got to have the vaccine. You got to have this. You got to have that. And then I saw Dr. Anthony Fauci, a.k.a. Flip-Flop Fauci, talking about, oh, well, we might need to wear masks for 2 more years. 2 more years, so really? Last year, right around this time last year, actually, when the virus first popped, like early March, you were saying that the average person should not be wearing the mask out there in the public if they're not sick. That's what you said because, it might block a droplet or two, but it won't really help you to prevent from spreading it or catching it. That's what I was told. And I'm seeing actual doctors, actual physicians, not my opinion. I'm no doctor. I'm no physician. But actual doctors are saying, hey, this mask is not really giving you the protection you think it is. Same thing Fauci said. They were like, if you have a chain link fence and you're throwing hay at the chain link fence, of course, they may catch some of the hay, but obviously a lot of the hay is going to get through your chain link fence. This is not giving you a real adequate level of protection. So what's the purpose in really doing it? I can't really call it. I think what Fauci said from the beginning is right. He said it makes you feel better by having the mask on. It makes you feel better by being able to go and still conduct daily life and not be holed up in your house forever. That's how it feels. But really, is it doing anything for you? If it is, and I can't tell, all right? It's talking about it's helping with the flu. I think the thing with the flu is that everything, any kind of common cold flu is now just wrapped up in just a virus, okay? Because isn't a common cold also a form of this same virus? So if they're testing for the virus, but it's the same kind of, it's the same family as a common cold, why would there be any cases of the common cold anymore? Why? It's all wrapped up in the virus. So what's really going on? Okay, that's my question to anybody out there. Think about this whole thing. What's really happening? And I'm seeing propaganda get put out there by the World Health Organization. Well, propaganda, well, I'll put it to you like this. They've kind of relinquished some of their propaganda and fear mongering. Here's what happened. Inauguration Day, January 20th, 2021. They changed the way that they test for the virus, which resulted in far fewer false positives. And right after that day, you saw a sharp decrease in the amount of positive virus cases in the US and UK specifically. Not really anywhere else. Not really France, Germany. India has always been low because they got HCQ over the counter. That's a different story. Anyway, there was a sharp drop off in the amount of positive virus cases. I think they would say one doctor said there's been a 75 or 77% decrease in new virus cases since the inauguration. Come on, we know what's going on. It's all a big game. It's all a big game. They're playing games with the numbers. They're giving you whatever they want you to hear. They're playing games with this whole thing about the mask and distancing and all that kind of stuff working. A prime example of how ridiculous this whole mask thing is when you go to the airport, you got a distance in the TSA line. You got a distance at the actual gate before you get on the plane. You know, like when you go up to the thing to scan your pass, you got to keep distance in between people. One guy came up to me talking about, oh, don't go up there yet, man. You got distance. It's like, man, if you don't get away from me. But anyway, you go through all this distancing and all this and that. You get on the plane and you elbow to elbow next to your your plane mate, you know, or your fellow passenger. What's the point in doing all this distancing outside the plane in a more open area and then do less of it inside the plane in a less open area? It makes no sense. None of this makes any sense. I think as I close, we need to get back to normal life. That's just a long and short of it. Let's get back to normal. All these, you know, shutdowns and procedures aren't really working. All these numbers don't make any sense. Don't tell me that there's no more flu. Don't tell me that. Don't tell me a thing that's been around for forever is all of a sudden not around anymore. But the other thing is still around and we got to wear masks 2 more years. Stop it. Let's cut the baloney. Let's get past all of this. The political games is just no need. All right. We got people dying when they shouldn't be dying unnecessarily. We all know that senior citizens, we know who are the biggest at-risk groups in America for this whole thing. Okay. Now, I'm not a vaccine fan, but some people are. Some people say it's going to work. It might help them. Okay, that's fine. DeSantis, the governor of Florida, had disregarded some federal recommendations about how to distribute the vaccine, apparently, and he prioritized senior citizens. And then a lot of the leftists and the mainstream media got mad at him for it. But it's like, why would you get mad at him? Obviously, from the numbers, from what I see, the group most affected by the virus are senior citizens. So why wouldn't they be first in line to get the vaccine if they want it? Why not? It just makes sense. They're saying that he should not give the most vulnerable people the vaccine first. Why? It's just political stuff that we're doing with right now. Let's get past the political games and do things that make sense logically. But I think I'll leave that right there for now. And what say you? Do you think that the flu is actually eradicated in UK? How about over here in the US? We went from 400,000 hospitalized in 1 year to 165 hospitalized in that same period of time. So from 400,000 to 165, let's stop the games. Let's stop playing around. But am I wrong with what I'm saying? Am I just a conspiracy theorist? Should I take off this hat here and put on the tinfoil hat? Is that what I should do? Because what I'm saying doesn't make any sense at all. Okay. Maybe I didn't hear Anthony Fauci just last year, back in March, when the virus first popped, talking about don't wear a mask. And then a week later talking about, yeah, put the mask on. What changed in the week? Trust the science, right? Why does science keep changing? Okay. Why does it keep changing if I got to trust it? If you tell me a thing that you want me to believe as true, then I should always believe that, right? I shouldn't be, thinking that you're going to change up on me and have a different point of view. But whatever your thoughts are, please let me know in the comments below. And that's all I got to say for this video. If you like what you heard, please comment, rate, share, and subscribe. Peace.